Ladies and gentlemen, welcome to our show tonight. And before we begin, because you have just touched my table, I'll just pass this around. You just need to do that because you have just come here. I don't know what you carry, and you're touching our table and glasses. And obviously, let's begin the discussion with the announcement tonight from the Cabinet Secretary in charge of Health. This is Mutahi Kagwe. And I begin with you, Dr. Mercy. Today's confirmation and the other information that came through. 111 cases have been tested, 23 others have been quarantined, being observed, and probably tonight as we go to bed, there might be an announcement tomorrow. But the 4 cases, your analysis last week and this week, and we only have 4 cases. Yes.
So, Ken, it's important to start, I feel, on a note of optimism. And when you were introducing the show, you mentioned that Kenya is in the right direction. And I'd like to echo those sentiments that you've shared. Indeed, we're in the right direction because our president, His Excellency Uhuru Kenyatta, is being lauded for being one of the only African presidents to take a very decisive move. The interventions that you've seen directed through the National Emergency Response Committee are interventions that require a fight response, are interventions that are actually going to help us contain these cases. So yes, indeed, today the CS, Mutahi Kagwe, did announce the 4th case. And again, it was important for us to be able to understand that these cases are in stable condition. And the monitoring and how do I say, the ability of the system to be able to detect these cases is a testament to the resilience in the system and in the efforts that the government is making in trying to track these cases. So we are doing well, Ken, and I'm just trying to say optimism is useful and relevant in such a situation, and to emphasize that Kenya is in the right direction. We are actually going to be featuring in global media very soon, and our president will be featuring for making very decisive moves, and he's being lauded for that.
I'd like you to talk about that decisive move in the next few minutes, but let me have the analysis of Dr. Otuoma. You have had what has happened, 4 cases reported. The first one was last week, I think on the 12th, right? And today there's another case that has been reported. Overnight we might hear, because there are 23 who've been quarantined, there are more reports. Your analysis of our situation so far?
I think our situation so far has been informative. At least the general public, as maybe you are looking at Twitter, everybody is aware that there's a problem called coronavirus. Now, I can divide that into 2. There's that social aspect of it, and then there's the medical aspect of it, that we need to look at how well the country is prepared. And I think maybe they're in a better position to comment on what the government has done. But as a citizen and somebody who also understands on how some of these zoonotic diseases or epidemiologies really present themselves, we are looking at certain indicators to really see how well we are prepared. Where I sit currently, I'm seeing that on the social side, we are doing very well. Yeah, but on the medical side is what also needs to be very clear as to how well prepared the country is, and maybe they'll be in a better position to comment on that, because you can make pronouncements on certain policies, but if you look at how even the disease spread itself, if you just look at the genesis of the whole problem, in that province they are calling in China Wuhan or something like that, Wuhan. All the time with epidemiologies, you look at the cause, the source. How did it start? Then you start looking at how it spread. And then definitely the issue of how you can contain it and how you can treat it then will come into place. And we must be analyzing all those parameters as we speak, because this is not just a political decision. This is a highly professional decision that you need input in terms for you, even for the government, to be able to formulate the right policies. So you must be saying that the information that is coming from the scientific community, the professionals, is adequate enough for the policymakers to make a decision. Because sometimes it can be a contradiction when we say we need a lockdown. And then you remember the other day, and I'm happy that maybe later it was realized that even children who are confined in boarding schools, it will not just have been an umbrella to say move and go back home. Because that one you are promoting or prompting mass movement of people, millions of people, parents, students, who are already in some areas. So you must also be having adequate plans that as we say we want to move these groups that are already confined, how do they move? Because it will be almost be counterproductive to your policy of saying you know, you are quarantined.
Yes.
Because you are quarantined, and then here, in the part of making some of the decisions, you are also promoting mass movement of people.
Okay.
If it is not properly controlled, because later I heard that the public transport had to be specific,
and even
school
today,
buses
the CS had further announcement on that.
But initially when it was announced, it was not very clear. So that took some of us aback and say, how do you get somebody from Maranda to transit from Kisumu, Nakuru, Nairobi, maybe to Mombasa on public transport, their parents? You know, that is almost millions of Kenyans.
Probably we'll have to specifically discuss those kind of intervention and if they were counterproductive or try and get into the thinking of the policymakers. Right. I'll come back to that. But Dr. Omar Oluga, always present in the hospital, your analogy of what has been happening in the last few days and the announcements.
Yeah, I think I'll agree that the last 2 weeks, the ministry and generally the whole country has been very aggressive, and those are very laudable steps. I think the closure of schools, the measures that were taken in terms of preparing isolations, there's been efforts by the president and also the cabinet secretary to really inform the public, and then that's really commendable to sort of cause calm in terms of the public. But also, on the other hand, there are also fundamental questions that are still coming from wananchi. I think that what the general citizens need to know is that we are in a crisis together. So it's not where, and this is especially for us, I've said this, it's not that whether one party is right and another party is wrong. It's like we are all trying to put effort together to keep ourselves safe. Of course, with the confirmation of one more case today, my own thinking is that there may be or there will be more cases. Before we confirm the case, I think I was on record saying that it's a matter of when. When 100 countries are already affected, I think it was just a matter of when. And even now, my own projection is that we may see a rise in cases. I don't think that should shock us. What we really need to do is to look at how do we respond to the people. And there's also something unique about the cases that we are seeing, is that they're Kenyans. You know, other countries started seeing cases that are not Kenyans. They, you know, either Italians or they're not their citizens. I mean, yeah. So that's also important. But fundamentally, also for me, that I have to mention is I have seen a lot of efforts. For example, today and yesterday, in terms of training health workers. There was a concern yesterday about giving them materials for protection. Which I think there are still huge gaps, whether the gaps are in the supply chain or the shortages globally. I think we have to take very keen note, which is not very good, that health workers as at today still have concerns of being protected. And I believe that the ministry is working on that, because if you know, when a patient presents, they will not necessarily present at the isolation center. They will present somewhere in Mombasa or somewhere in Kisumu or somewhere in Mandera, where the health worker has not been trained.
Dr.
And
I'd
they
like
do
to
not
specifically
have
talk about preparedness. I just wanted to clear this, because you have said it should not shock us that there could be many cases. Arising from what? Perhaps that's the question. Arising from the people who have been tested, the people who have been isolated. Arising from what? So,
Ken, coronavirus, COVID-19, is a new virus, and it's a virus that's being studied, and scientists across the world are trying to understand how it works. And so far, the data that we have from China and Italy and the heavy burden countries, the data is showing us that every time you have one confirmed case, that this case is bound to reproduce across to 2 people.
Minimum 2?
Yes, at least a minimum of 2. The heartbeat is that these facts are not, you know, how do I say, 100% certified, because it's a new disease and we are learning. And so, as Dr. Oluga has said, it should not surprise us should we have more positive cases. In fact, if anything, it should be a sign towards our agility in the system in trying to detect these cases and ensure that they're properly managed. As the situation evolves, we monitoring and seeing how the graphs rose and descended in different countries. And it's almost likely from the epidemiology, as the Honorable MP here has said, that this is bound to see an incline and then a decline. And so what is important for Kenyans to understand is all this raft of measures that have been put in place by the President and that are being stewarded by the CS Health is to attempt to actually have this rise and fall broadened to reduce the number of new infections.
It's bound to rise. It has to rise. That's
the way the epidemiology is looking like in all the countries that are affected, that's the trend. That's what the science and numbers are telling us.
Okay.